Hello, and thanks for joining us. My name is Stephen Perlin. I am outside UHS Vestal, and while it might not be the day we were hoping, a little too much rain for our liking, we are out here because it is winter. And with winter and snow, that's still remaining right now, is shoveling. And it's an important thing to remember about shoveling that it's more about the form you're doing, and obviously you got to be careful because of your heart. So that's something that's very important that we want to talk to you about today, because there are a lot of people who go out there, they don't properly get ready for shoveling. They do a lot of incorrect form for the lack of a better phrasing, and they don't, like I said, warm up the right way, and they end up hurting themselves in more than one way. And heart health is very important, as we know, with February being Heart Month right around the corner, so we're here to talk to you. Joining me today is Kelly Buckbaum from the Owego Physical Therapy, and Christopher Mosconi from UHS Cardiac Rehabilitation. Thank you both for joining me. Really appreciate your time today.
Thanks for having us.
Thank you for having me.
All right, so Chris, let's start off and talk about the heart. I mean, obviously a very important muscle, and when you're out there shoveling, it might not be the muscle you're thinking about most because you're using some other muscles while you're out there, but it's a very important one, and you want to obviously be very careful when you're talking about your heart.
Yes, that's correct, Steve. And unfortunately, one of our busiest times of the year happens to be after the biggest snowstorm of the year, or the first snowstorm of the year. With that being said, it's not so much individuals going out and working too hard while they're shoveling. It's about the weather, individuals improperly warming up, and with the weather, the cold weather specifically, cold weather causes blood vessels to constrict, making your heart rate and your blood pressure higher than normal. When your blood pressure and heart rate's higher than normal, your heart has to work a little harder than it normally does. Also, with the cold weather, it's important to warm up. A lot of the times, we see individuals go right out when they see snow and just start shoveling. And whether that's okay for some people and not for others, it depends on that individual. What I would recommend is going out, seeing how much snow there is, coming back inside, warming up properly, whether that's a couple laps around your house, some arm circles, just something to get the blood flowing, as well as pacing yourself. Just because the snow's on the ground doesn't mean it needs to be done right this minute. You can go out for 5 minutes, come back in for 5 minutes, go out for 10 minutes, come back in for 10 minutes. Give yourself a little rest. It's also important to know the warning signs of heart disease, or if you're having any chest pressure or anything. So whether you're out shoveling and you're having some chest pressure, some dizziness, for some people you might get a pain in your neck, things like that, a sudden onset of sweat, it might be a good idea to go inside and take a little rest. If those symptoms persist, it might be a good idea to call your doctor and see what they have in mind for you to do. And again, speaking of your doctor, if you're an individual with known heart disease, it'd be a good idea to consult your doctor before going out and shoveling and get their opinion on things.
So that's a lot of good tips. Thank you, Chris. And the big thing I think to make sure is that you're aware of the symptoms, that you are aware if you're feeling a certain way or if something feels off, and to do something about it. I think that's another great tip. You don't have to do it all at once. I know I always try to go out there and I'm like, oh, I got to get this done immediately, but there's time in the day, and you could do a little bit at a time and make sure that you take small portions. Are there any other tips that you want to make sure that we get out there, Chris?
I think that's about all I have. I think I would have a lot of information that Kelly's going to share with in a couple of minutes, or well, I guess right now.
Yeah, and that's something that I'm very excited about, and I'll tell you why. I'm pretty sure I pulled something in my neck or upper shoulders when I was shoveling pretty recently, so I'm going to take these tips to heart. Kelly, talk to me about what people should be doing when they're shoveling. I mean, everybody, I think thinks you go out there, you're picking up the snow, you're pushing it, but there's a little bit more to that, and you want to be smart. Am I right?
You are. So a couple things that I wanted to talk about is maybe deciding when you go out and shovel. I think we touched on it a little bit, but one of the biggest reasons that I would hold off from going out very first thing in the morning is we have discs in our back and in between the vertebrae, and they tend to be the most viscous first thing in the morning when we first get up. And so they are the most vulnerable to injury at that point, especially all of the bending and lifting we would be doing with shoveling. So I agree. I think we should be warming up a little bit. My warm-ups might consist of a little bit of exercises to actually activate the muscles that we might want to use for shoveling. And I will tell you that you use a lot of different muscles for shoveling than in most daily activities. So
That's why I'm feeling it. Yeah, I was gonna
exactly.
say.
So you really do want to kind of get warmed up. Maybe if you do a regular exercise routine, maybe do that before you go out. And get those muscles activated, get them warmed up, get the blood flowing, all of those good things. So I think that's one really good point that I would mention. Secondly, I will reiterate the importance of going out multiple times and shoveling lighter loads versus trying to go out once and doing all the heavy loads. It's just really not good for us in general. Our spines take the brunt of that, our necks, our backs, all of that. So I would definitely suggest going out and doing much lighter loads.
It's like you're talking right to me.
Yeah. And then sometimes, we talk about pushing the snow versus, bending, lifting consistently. I'll be honest with you, I don't think there's any great, perfect form for shoveling. So we want to make sure that we're doing the best we can to push it and not do the lifting. But in case we do have to do some lifting, you want to make sure that you're keeping your spine pretty straight. You're using your legs. And not too much of your backs or your upper bodies. And then I would say lastly with that, you want to make sure that you are not twisting with the load. You want to kind of, pivot if you have to, but pivot your whole body and not really twisting your spine with a heavier load. And then, like I said, I think we need to expect that we're going to be sore after shoveling. I think that if you're not in amazing shape or, any kind of that type of shape, you need to expect to be sore. And so the answer is not to just go in and lay down for the next 4 to 6 hours and not move. We need to move. You need to do a little stretching and just know that you're sore. The other thing is when it's cold, we don't really want to drink as much. So making sure we're hydrated. Soreness can stick around more if we're not hydrated well. And just make sure we're taking care of our bodies. So expect the soreness, move through it, go for a walk, do some stretching, and hopefully that soreness doesn't turn into an injury. Strains and sprains can start with some of that, and you could probably work it out before you ever even need to come see us.
That's great. Now, I think an important point you mentioned is the hydration, because a lot of times, you're out in the cold, the first thing you think of is not a cold drink of water or something like that. You want a hot chocolate or a coffee to warm yourself up, but it's important to make sure you're getting that hydration as well, correct?
100%, yep.
I got to imagine that's important for heart health as well?
Yes, actually, in the wintertime, we all think of snow, rain. We think of that it's pretty moist out. However, when you're in the cold temperatures, it ends up actually being pretty dry out. And when it's dry, you breathe a little more, and you actually dehydrate yourself a little more. When your body becomes dehydrated, your blood becomes a little thicker. Your heart has to work a little harder to pump that blood to all of its needed destinations.
All right, and now we got one last part of this live. Kelly's going to show us a little bit of a demonstration on how to be shoveling to make sure you're not doing doing it the wrong way. Unfortunately, the weather, we don't have as much snow as we originally thought we would when we were planning this. For the record, there was a lot more snow, obviously. Everybody watching probably knows that. But Kelly, I'll get out of the way, let you show a little bit.
Hold it. So realistically, we want to make sure that if you can, you're actually able to push the snow. And again, use your legs and your trunk to help with that, but keeping your back straight. If you were to ever have to lift it, you want to make sure hands placement is good so that you can use your upper body appropriately. Back stays straight, legs are bent. You want to lift with your body, and same thing, instead of twisting, you would want to turn and kind of do it all together as one.
All right.
I don't know how my husband and boys will feel about me doing that, but we'll see. They're usually the ones who shovel.
Well, there you go. That's why you have us.
Yeah, right? Exactly.
Well, thank you, everybody, for joining us today. A lot of important. Most importantly, to make sure that you understand the symptoms, know what you're feeling when you're feeling it, and not to push it. You definitely do not want to push it when you're out there. And now you know how to do it correctly, so make sure you're using the right form, and don't be worried if you're sore. I was a little, but I know I'm okay, so that's good. Thank you again for joining us, and we'll see you all soon. Thank you, guys.
Thank you.